Thank you, Mr. Chairman. I want to start out by thanking the Finance Committee staff for their time and energy and expertise. It was a colossal and well-considered and well-done effort with each of our offices, and I know there probably was not a member of this committee that didn't step up in a big way. I want to thank Chairman Hatch and Ranking Member Wyden for including 3 of the priorities that I had in this mark. The CRIB Act was my bill to increase access to care for babies born suffering from opioid withdrawal facilities like Bridget's Path outside Dayton, Ohio. I want to thank Senator Portman especially and Senator Capito for their work on this legislation. The Comprehensive Screenings for Seniors Act, a bill I drafted with Senator Isaacson and Senator Nelson, both members of this committee, to encourage doctors, nurses, and physician assistants to have meaningful conversations with their patients about addiction risks and pain management the same way they might discuss diabetes and other health conditions. Last, thanks to the leadership of Senator Grassley, we've been able to get an improvement to the Sunshine Act included in the chairman's mark, which will increase transparency around the payments that opioid manufacturers make to prescribers of these addictive medications. I'm also pleased the subcommittee was able to get an agreement to discharge the STOP Act legislation. I've worked on with Senator Portman and Senator Cardin so that it can be considered for inclusion as part of a large Senate package later this year. I'm appreciative that the final mark includes those bipartisan priorities in addition to several other policies. I remain concerned that many of the bills that have passed out of the House recently and that we're considering here today represent small improvements to current law when this public health crisis demands something much bigger. Small improvements, simply put, will not turn the tide in this epidemic. We need to invest resources across the full continuum of care to increase access to treatment and provide communities with support that they need to get ahead of this epidemic. There are other bipartisan priorities that members of this committee have been working on that have the potential to make a real difference right now in fighting this epidemic. Today's markup may not be the right time to consider all of these, but we can't let this markup be the last thing the Finance Committee does to address this problem. I'm reminded of the Cleveland City Club, where Rob has spoken a number of times, as I have, a 100-year-old club in Cleveland that has featured pretty much every major political figure, presidents on down to the rest of us over the years. And I mentioned that 50 years ago or so, the federal government decided it wanted to engage in the tobacco issue, something near and dear to Chairman Hatch's heart and many of the rest of us. And in when I believe the Surgeon General's name was Dr. Terry, if I remember, when he brought this forward, 45% of American adults smoked. And because of the resources of the federal government and local communities and all kinds of organizations, that number has gone from 45% of American adults smoke 50 years ago to 15% today. So we know how to launch big public health initiatives. We need to think bigger. We need the president to weigh in. This isn't you don't arrest your way or execute your way out of this. We need a broad-based, comprehensive approach that we are capable of doing, Mr. Chairman. But thank you.